Thank you so much for joining us today. We are Worldview Wellness, Health Matters. I'm Tye.
And I'm Micah.
And today we're going to be talking about labs. We're going to be talking about reference ranges, how lab reference ranges vary from region to region, how you interpret integrative functional labs that you get on our clients. But first, I want to start out by talking about the company that we use for those labs, which is Avexia Diagnostics, and the unique system, which makes it a lot more convenient for us and our clients. So tell us a little bit about our partnership with Avexia, how they work.
Well, Avexia pretty much allows us to do what it is that we do. They are a third-party lab service. They partner with a multitude of different lab companies that allow us to get everything from just basic labs that we would get through LabCorp, all the way up to very, very advanced specialty labs that allow us to look at very specific information like genetics, hormones, gut function, just pretty much anything that you can think of, and just about everything that's out there. I can order some version of that through Avexia. So it really is a very good partnership. It allows us to do what we do, and in order, which is a lot, and we have to do a lot in order to do thorough terrain evaluations. So
exactly, I love it. It's very, very convenient for us. It's convenient for our clients. I kind of want to talk about your training. I want to talk about why we use the wide array of labs that we use. You were trained in the metabolic approach to cancer through Dr. Nasha Winters. I was trained through the TAP advocacy program through Dr. Nasha Winters. And you have been in the medical industry for about 20 years now. So you have seen everything from being a paramedic.
This year's 20 years.
Yeah.
2003.
That's crazy, isn't it?
Yeah.
So you were a paramedic for a long time. You worked in standard of care medicine pretty much in every modality that there was as a physician assistant. And once you started to become dissatisfied with what you were seeing with your patients, which was nobody was ever getting any better, you really started to kind of research and reach out and look for a better way of health and healing and how to optimize that, which then took us to Veritas Medical. And you worked for Dr. Ben for about 4 years. Your father had a cancer diagnosis, which scared us. Dr. Ben referred us to Dr. Nasha Winters and her metabolic approach to cancer. You then decided to join her master class, which was like, you always like to say that it's like drinking water from
a fire hydrant.
Yeah, it was intense.
Yeah.
It was intense. And so you have been one of Dr. Nasha's preferred clinicians for about the last 2.5 years. And Avexia has made it possible for us to really make this a well-rounded tele-wellness consultation business.
Yep, absolutely. It's been quite a journey.
It really has. So with Avexia, what we do is Micah puts in the lab order. Our clients will get into their own Avexia account, pay the lab order, print off the requisition form, make an appointment with their local LabCorp or hospital lab, and have the draw initiated. Then within about a week and a half, those results come to us. Our labs tend to be a lot more intense than what you would see at, let's just say, your general practitioner's office.
I would agree with that.
Yeah, it really is. So let's educate people on the how and the why. Talk to me about the lab panel that you like to get, the depth of it, and the why.
Well, I think I'd like to probably start off by just talking about the conventional lab panel. We'd be here all day if we talked about the lab panel that I typically order. So
it's a big one.
The conventional, just your regular follow-up lab panel that you're going to get from a conventional doctor or medical practitioners, going to be something like a complete blood count or CBC, a complete metabolic panel, lipid or cholesterol tests, certain nutrients maybe, certain inflammatory markers maybe, and then maybe something on the thyroid. And then that's pretty much all you're going to get on a conventional workup. And trust me, there's a lot of information that's in that, but I look at that as a very, very basic evaluation that doesn't really go into too much detail. So just, to give you a little bit more meat of what those tests consist of, a CBC or complete blood count is going to primarily look at white blood cell count, red blood cell count, hemoglobin, which is the protein in the blood that carries oxygen and how you make energy, It's going to look at the hematocrit, or the percentage of the blood that's occupied by the red blood cells, which most people are surprised to learn consists of less than half of the blood most of the time. The rest of the blood is made up of proteins and serum and electrolytes and platelets, in addition to white blood cells. Then we also look at the platelets, and then we start looking into the differential, where we are looking at hemoglobin concentrations, sizes of the different red blood, or size variation of red blood cells, the different types and breakdown in percentages of the different types of white blood cells, obviously there's a lot that you can learn in a CBC by itself. Next, we go to the complete metabolic panel, which typically looks at liver and kidney function, protein status, electrolytes, and there's a lot of different ways that you can look at a metabolic panel to uncover different errors in metabolism and just metabolic knowledge in general. Then there's, like I said, the lipid and cholesterol panel. That's typically looking at total cholesterol, triglycerides, HDL, LDL, VLDL, and then some of the ratios between the different subcomponents there. Then at some clinics, but not all clinics, you might get some labs run on some nutrients. So those might be minerals like magnesium or copper or iron, or they might be vitamins like vitamin A, vitamin D, vitamin B12, those types of things. Now, I think that probably, if I were going to guess, the majority of clinics don't run too much of that. And if they do, it's going to be a pretty small portion of their evaluation. I think that in the future, if things go in the right direction, there will be a lot more measuring of nutrients, because I think that most things are at least related to and correlated to nutrient deficiencies. The next thing would be inflammatory markers. So those would be things like erythrocyte sedimentation rate. I look at ferritin as an inflammatory marker. There's homocysteine, there's C-reactive protein, there's all kinds of different inflammatory markers that we can look at. And that's another one that may or may not get checked on a conventional blood panel. And then finally are the thyroid labs. So most of the time, you're either not going to have any thyroid labs on a conventional blood panel, or if they are on there, it's going to be limited to either the TSH, which is thyroid stimulating hormone, and or a TSH plus either a free or total T4, which is one of the different types of hormones that come out of the thyroid. So, ultimately, this is what's going to be on a basic lab panel. Whenever I order a lab panel, of course, all of what I've discussed or what I've already discussed is on the lab panel. But then there's a whole plethora of other things. I get multiple different inflammatory markers. I'm looking at a much more complete thyroid panel, and then I'm also checking, just a whole plethora of other things that give me a much better assessment of the terrain of the individual that I'm trying to give good counsel to. The panel that I get is what I've been used to probably for the past 5 or 6 years. Certainly since I started working at Veritas, it's very similar to their wellness panel. And while I was at Veritas, we would have some people that want to run their, that particular lab panel that I get, through their insurance, and some insurances would say that the panel was significantly, over $2,000 in some cases. And, when we go through Avexia to do that panel, it's usually about $140, and then I think Avexia adds a couple of little fees, and then there might be a draw fee associated with that. But for what you get out of the panel that we get on our clients, it's definitely a much bigger bang for your buck.
So I want to say that we see all different kinds of clients.
Yeah,
We see
absolutely.
people with light wellness needs, people who just want some supplement recommendations. We see people who want light wellness panels. We also see people with heart disease, diabetes. We have clients who have cancer. So we really do individualize these lab panels according to what you feel like you need to see. And I do want to talk about the inflammatory markers. You and I have talked about how they are greatly undervalued in lab assessment, oftentimes. And tell me why you get these inflammation markers and why you feel like they're so important.
Well, most of the time when I'm checking inflammation markers, it's going to be on somebody that's either got cancer or that has more what I would consider complex chronic disease. So we're talking about people like with chronic fatigue syndrome, Lyme or mold disease, maybe fibromyalgia or things that are kind of similar to that. And so it's really important to do a pretty thorough and broad assessment, especially in the inflammation part, in order to determine what that person actually needs. And so, Dr. Nasha Winters developed what she calls the trifecta, and those inflammatory markers are lactate dehydrogenase or LD. Some people say LDH. And then there's a set of 5 isoenzymes that comes along with that. So I get both the total number and then also the 5 isoenzyme values. And the isoenzyme values allow me to determine kind of where the inflammation is coming from. Is it coming from the muscles or the bone or the liver or there's all kinds of different interpretations based on the isoenzyme numbers. I'm also looking at a C-reactive protein. That's a pretty generalized inflammatory marker, but very, very important in order to evaluate overall terrain function. And then also the last one is the erythrocyte sedimentation rate. So that's another value that's more seen as a general inflammatory marker. But throughout the last several decades of treating cancer patients, Nasha, through studying the literature and really trying to come up with a science-based approach, uncovered that those 3 inflammatory markers are the most prognostic in cases of systemic inflammation, including cancer.
And she calls those the trifecta, correct?
Correct. Yeah, the trifecta.
So the way that you read labs and the reference ranges, it's pretty different than what you would get, let's say, if you just stepped into your GP's office and wanted to get a basic lab panel. Would you talk to me about why your reference ranges are different than the standard of care?
Well, I mean, the first thing that I would say is it's because my reference ranges are not what's on that piece of paper. The reference ranges that come from any lab, pretty much, because labs are held and regulated pretty strictly. So the labs have to report reference ranges in a particular manner. And I do my best to educate my clients on the fact that the conventional reference ranges are not necessarily what's indicative of true health. It's more reflective of the population at large, and those numbers come from an averaging of lab values that come out of the general population, and then trying to decide how many standard deviations above and below that average value are we going to go in order to complete the reference range. So, that's really just not reflective of health. It's reflective of our society. And so you can read today's Substack and get some statistics on how healthy we are as a country. I didn't go into super great detail there, but we're not healthy as a country. And so if you are trying to be in the middle of your reference range pretty much on anything, on your lab report, then you're not really reflective of health. You're reflective of what you see when you go to the mall or what you see when you go to the fair, which typically is not going to be reflective of health.
So kind of what I'm gathering is that it's going to change from region to region,
Absolutely,
which
yeah.
blew me away. The first time you told me that numbers will change from region to region, I couldn't understand that because people are people, right?
Well, true, but different people in different areas, the demographics change, the diet changes, there's, the environment changes, and all of those are crucial in order to, when you're looking at lab values. So, for instance, you check blood sugars in the panhandle of Texas, where we're at, and those ranges are typically going to be somewhere in the 65 to 99 range. Now that's all fine and dandy. That's, I've practiced in Texas pretty much my entire career. So, um, at the end of the day, that's what I'm used to seeing, even though I would say that a fasting lab value ought to be significantly below 99. So I would not consider a fasting sugar reading of 99 in the normal range. I would say that that's an elevated range. But if you compare what we get in Texas to, say, Mississippi, then you're going to get a standard reference range that might look something like 75 or 80 all the way up to 120, or in some cases even 139, 140. And so your question is very pertinent, which is, are the people different? And I would say no, the people aren't different at all. It's the environment, it's their diet, maybe the demographics a little bit different, but ultimately, the reason why they have those reference ranges in Mississippi is because the average person in Mississippi is going to be closer to diabetes, is going to be more overweight, they're going to have more incidence of heart disease, probably more incidence of cancer. And that is just because those insulins, those blood sugars, some of the things that are going to change from region to region, that's what is reflective in those lab values.
I want to talk about diabetes really quickly. For instance, we have a lot of clients who come to us, and when you tell them that they are in a pre diabetic state or that they are diabetic, they're
Right.
often very shocked because what the lab reference range is not, doesn't reflect what their doctor told
Right.
them.
Well, a lot of people get diagnosed very late in the course of disease, specifically about diabetes. Um, you know, from a functional standpoint, I think that it is important to start to intervene. Well, outside of labs, I think it's important to intervene before there are any problems and do preventative medicine. Outside of that, I think that is it fair to someone who has a diabetic process to advise them that they are pre-diabetic, and which would lend them to maybe not be quite so aggressive, might maybe not quite so concerned about their health whenever they do have insulin resistance and metabolic syndrome and all of those types of things, when I would just call that diabetes. If you're pre-diabetic, then ultimately you're a diabetic because there's something wrong. There's a metabolic disturbance that is creating insulin resistance, that's creating abnormal deposits of fat in the liver, that's creating abnormal deposits of fat, basically in your midsection. Um, the brain chemistry changes, the GI function and the way that your stomach and gut works changes. And so I don't really consider it to be good practice to use the conventional guidelines surrounding prediabetes and diabetes. And so, to that effect, I will typically tell somebody that's got a blood sugar of even like say 95. I'll tell them, especially if they've got a hemoglobin A1C that's at or above 5.6. I'll go ahead and tell that person that they're a diabetic and that we need to start doing some lifestyle changes so that they can avoid a lifelong struggle with that insulin resistance process. Whereas in the conventional medicine, they might get told that they're, pre-diabetic, and they can go on metformin or a different medication, or maybe even take some supplements like berberine or something along those lines in order to help with with blood sugar and with sweet tooth and all that type of thing. We go ahead and deal with, we just go ahead and call it what it is. I don't necessarily believe in pre-diabetes and diabetes. I think that if you've got insulin resistance, then you're diabetic. And you can actually reverse that and change that, even if you've been a long-term diabetic. In the vast majority of cases, lifestyle is all you need to fix that.
Let's talk about some of the other reference ranges and lab values that you see that are often don't quite line up with what standard of care may be. For instance, vitamin D might be
Yeah,
one.
vitamin D is one of my favorites to talk about because I think that in order to really truly understand that, you have to understand kind of the deception that happens basically in the United States since probably around 1955. So 1955 was when President Eisenhower had his heart attack. And then Ansel Keys, who was a physiologist of the time, came in and started pushing the low-fat diet. And so if you go back and you uh, consider that we've essentially, for the last close to 80 years, been given nutritional advice or surrounding the low-fat diet, and then you look at the fat-soluble vitamins, so those would be vitamins A and D and E and K. Then we have the average of the vitamin D levels, and the reference range of vitamin D in our country is anywhere between 30 and 100. But I go back and I look at, okay, we have 80 years of a low-fat diet. So what's that going to do to fat-soluble vitamin levels? And how does that factor in when you consider how, lab values are averaged and all that type of thing? So I think it's probably fairly safe to assume that true vitamin D levels that are reflective of health are probably considerably above that. And then that correlates with the most recent data out there that shows that vitamin D levels that are necessary in order to prevent, in order to prevent getting seasonal respiratory viruses like COVID or the flu or just regular colds. That number for vitamin D is typically around 55, and so that really, in my opinion, ought to be the low end of normal. If vitamin D levels below 55 make you susceptible to getting seasonal viral illnesses, then it would probably make good sense to recommend that that's the low end of the normal, the normal reference range.
Well, we have a lot of clients who are pretty sick, and they bring us on board, to help them with the integrative functional standard of care that we can give them to help bolster their system while they're having chemotherapy done, while they're having radiation done. And sometimes people just want the integrative functional approach without anything else to
Right.
pair it with. And so, what I want to say about that is that the integrative functional approach is a plan that can stand alone or is also a beautiful benefit to any other therapies that you are engaging in.
Yeah, and sometimes I would, I would say that that's probably not always appropriate. I think that there's certainly a time and a place to do conventional medicine, even in cancer. It all depends on the person's terrain and where they're at. But one of the things that they would get at Worldview Wellness that they're not going to get most other places is the autonomy of being able to make that decision themselves. I don't need to agree with them if they don't want to do conventional therapy.
Right.
They are going to have their autonomy respected, and we're going to do what we can do within the parameters of the wishes of the patient. And that's one of the most important things for us, is that we honor the patient's wishes and that we give them informed consent. And past that point, it's their decision. We always like to tell people that they are the captain of their ship and they get to steer the boat. So we definitely honor that. But to that point, sometimes I will make a recommendation. Hey, I think that this particular chemotherapy or radiation is appropriate for you at this point in the game, based on what I'm seeing in your labs and all of the different evaluations that we do. But at the end of the day, we honor their journey.
Right. Right. And it is in their hands, and it is important that we know about our own health because our health matters. But we have clients who come back to us who have been to see their oncologist or been to another, clinician, who are just panicked because of the levels of vitamin D.
Right. So, I would say to that, I've never seen anybody, compared to your average clinician, I probably recommend vitamin D supplementation at a much, much higher rate. If you look at the conventional guidelines, typically, most of the hospital data and all the recommendations from various medical organizations would basically say that you shouldn't ever recommend someone take vitamin D at on a daily basis higher than, say, 4,000 international units or IUs. Sometimes you might occasionally see 5,000. The vast majority of the people that I've that are currently under our care, and certainly patients that I've had in the past, the majority of people who typically have vitamin D levels on average At least in my clinical experience at, 30, 40, and a lot of people even below 30, I recommend 10,000 units a day. And if you read the conventional medical literature, you would think that I was trying to poison all my patients. But I do check vitamin D levels on them quite regularly. And uh, you know, um, I do have a different reference range. My reference range goes from about 80 to 120 when I'm using the metabolic approach to cancer. And I certainly try to keep everybody that's not cancering above 55. But 10,000, like, let's just say that I have a client or a patient that is at a level of 30, and I give them the recommended 4,000 international units. If they're at 30, then that might get them up to 40 or 45. And then that's all that's going to do. And so, based on what I've already said, that levels below 55 are put you in danger of getting the seasonal respiratory virus or viral infections, then obviously that's not enough, right? So, there's definitely a big disconnect with how I see vitamin D levels and how I use vitamin D in my practice compared to the conventional recommendations.
Well, and we want to say also that there's never one plan that fits everybody. Every single thing we do is customized
Right.
to that person's terrain, to what they're experiencing, and we never see somebody as just labs
Right.
and a client. We
Well, and
see them
that's
as body, mind, spirit,
yeah.
soul.
And that's the importance of reevaluating the labs. I might put someone on 10,000 or 4 or 5,000 units of vitamin D, and that takes their level of 30 up to 60. Well, that would be an individual response. That's not typically what you're going to see, but that's why the test, assess, address model is so crucial, because you don't know what you're doing if you're not repeating the tests and seeing the responses to the different interventions that you do.
Yes, this is not spaghetti wellness. We do not throw pasta at the wall and see what sticks.
Right.
That's not how we choose. We test, assess, address, just like Dr. Nasha Winters taught us, and we never guess. So that's how we approach this. I want to talk to you about oxidation labs. I've had a lot of people approach me and ask me how we ask a lot of our clients to engage in IV therapies like IV alpha lipoic acid, IV vitamin C, things of that nature. So when someone is headed towards over oxidation, explain what that is, how we can tell, how you can see that through labs.
So oxidation is essentially it's a necessary process that happens in the human body. In chemistry terms, oxidation is the opposite of reduction, and so basically all that means is whether a molecule or an atom is gaining or losing electrons. So if you're oxidized, then you're losing electrons. If you're reducing, then you're gaining electrons. And so it might be a little bit easier for the layperson out there listening to think of just what the term antioxidant means, right? So we've been told for a long time at this point that we should take antioxidants to quell inflammation, and antioxidants are an important component of what we do, but that's only one side of the equation. So if we're antioxidizing, then that means that we're reducing, and if we're so on that spectrum, you have to appreciate the fact that you can be over oxidized, which creates an inflammatory state, but you can also be over reduced. And so it's really not about just taking antioxidants. Sometimes we do things purposefully to oxidize our bodies, and there can be health benefits from that too. The important thing is understanding that everything in the body is about balance. And so it's not about oxidation, it's not about reduction, it's about, do you have the right balance? Is your body able to quell reduction if it's over reduced? Is your body able to quell oxidation if it's over oxidized? And so that's really I think the important thing. So to that effect, to answer your question, when I'm looking at typically this is going to be a cancer patient who's on oxidative therapies, whether that's chemotherapy, whether that's on IV vitamin C, whether that is ozone therapies, or hyperbaric oxygen therapies. All of those things are oxidative in nature. And so what I'm specifically looking at would be the a component of the CBC that I didn't even mention before, called the RDW. Well, that is the red cell distribution width. And that basically tells me whether there's a lot of variation in the size of a red blood cell or whether there's not. So if that number is high, then that means that you might have some really big red blood cells, you might have some really small red blood cells, and ultimately that points to oxidative bone marrow. So if there's a lot of variation there, that means that the bone marrow is struggling, primarily probably due to an oxidative cause. And so elevated RDW values can be one of the important labs that allow me to look at oxidation. Another value that I calculate myself out of the CBC is called the neutrophil to lymphocyte ratio. That ratio, when you have a functional immune system, should be about 2 to 1. So two neutrophils to every one lymphocyte. And so we can look at those numbers and determine whether that is pretty close to a 2 to 1 ratio or whether that's way off. Another lab value that I like to look at is called the GGT. The GGT is an enzyme that comes from the liver that basically goes up whenever the body is trying to make glutathione, which is an antioxidant. And so when GGT is up, that's also another indicator of an oxidative state in the body. So when I'm looking at labs, I'm looking typically at all three of those, especially if the person is known to be on an oxidative therapy. And then that way I can kind of steer their recommendations around the state of their body.
If someone is in an oxidative state, what could that push them into? Let's say they were over-oxidated. What could that push them into?
Typically that can lead to things like cachexia, and increased inflammation and basically just terrain issues that you want to avoid when you're trying to fix complex issues.
When we first started this business, I remember thinking that high doses of IVC would be the silver bullet. That would be the thing that fixes everything, which I think is kind of a common misconception, which, again, is why I want to repeat this. We test, assess, address, and never, ever guess, because you're flying blind if you're just trying to guess, and you can really push somebody into a place that is not good for them, will not increase optimal health,
right,
and can push them into a negative direction.
Well, I think it's important to before you really even get into anything else, there's no one thing that's going to fix anybody from cancer. Cancer is a very complex illness. It's a lot more complex than anybody that's alive on this earth knows.
Well, we don't treat cancer.
Right.
We treat the terrain.
Yeah. Yeah. We that's really the foundation of what we do. We treat the terrain. I think it's important to understand cancer to some degree, and it's important to have some evidence backed and scientific level of training in doing that. But I think that the underlying principle behind the metabolic approach to cancer is that we're treating the body, we're not treating cancer. A long time ago, maybe 100 years ago and more, doctors understood that you don't treat disease, you treat the human, you treat the body. When you treat disease, you go down a rabbit hole that you can't get out of, because you're, the more you treat the disease, either you're creating dysfunction within the body, or as you treat it, and maybe even if you're successful, well, there becomes less and less to treat. And so you'll never end up with a perfectly healthy body. But if you treat the body and you understand the terrain and all of how the different systems of the body work seamlessly together in order to create this concept called homeostasis, or homeo meaning the body and stasis meaning the same. Everything's trying to work together to create, this balance, to keep things the same. And your body is not ever the same. It's a dynamic system. So there's constant changes and fluxes in how we operate, but the body's designed to be able to operate in that environment. And it's our job as, clinicians, in order to, be able to look at the entire terrain and evaluate and help the body achieve that homeostasis.
And again, we don't just see our clients as clients in labs. We see them as mind, body, spirit, soul.
Well,
stress,
yeah.
thought process, where they're at. And you and I have talked about this often. You can take all the things and do all the things and be engaged in all the therapies. But if you are not healed and whole, or at least working towards lessening the trauma in your life, dealing with any psychological issues like trauma, child abuse, sexual abuse, it could be a variety of different
And
things.
those are very common things too. And I would even say that, work on that front with somebody who is good at what they do. Not easy to find, but they are out there. Your emotional and your spiritual health, especially if you have cancer or you're dealing with any complex chronic illness. That's probably number one as far as what I've seen clinically as what's prognostic to success is uncovering those demons that we have, that everybody has. There's not one of us is exempt from this.
Right.
We all have our own baggage and our own issues. Some have more than others. But we don't ever compare ourselves to what somebody else has been through, because our perspective is unique, and it doesn't matter if someone's been through a lot more. That doesn't take away from the fact that there may have been things in your past that have hurt you.
That's right.
And they hurt you emotionally, and they hurt you spiritually. And when you really practice a mind, body, spirit type of medicine the way that we do, you can't ignore that, the importance of that. And I would tell anybody that that's at the very top of the list when you're trying to deal with these complex chronic diseases.
Right. Two of the most important things that we talk about to our clients would be diet and spiritual and mental well-being.
Yep, absolutely.
Because if you're in fight or flight all the time and your body is constantly trying to recover and recuperate, you're not going to be in a good, peaceful state of balance and healing.
Well, there's a lot of, the more experienced functional integrative clinicians that would just basically tell you that, you might be able to, with some supplements and with a targeted approach, you may be able to temporarily alleviate some of the burden of a complex chronic illness, but it will always come back if you don't deal with the underlying unresolved emotional and spiritual conflicts.
And we've seen that to be true.
Absolutely. 100%.
Well, that is a whole nother show, getting into the spiritual, emotional, and dietary aspect of what we do and how we should be treating our bodies. But on our next podcast, I kind of want to get into the weeds with the deep diagnostic tests that we can do. I kind of want to tell our viewers about our deep dive, or listeners rather, about our deep dive and how we do that and what we do with that, and talk about the diagnostic tests that we can add to the lab draws that Avexia offers. I just want to mention the convenience of it. Most of the diagnostic tests are kit specialty tests.
They send it right to your house.
Yes, it makes it so convenient. So no matter where you live in the United States, once you pay for that diagnostic kit, that is drop shipped to your home. You get to initiate that test at home, whatever that may be. They give you very specific directions if you have any issues. Of course, if you're our client, you can call us. You could also call Avexia. They'll walk you through it. And it gives us a detailed look at genetics, hormones, gut function, thyroid. What else? What else can we see through some of that diagnostic? We can see drivers and illnesses, where it's coming from.
Yeah, I mean, we can look at any system of the body.
Right. So I think that's kind of what we want to get into next time, is really kind of...
So, yeah, we can definitely get into that. The tricky part of that is, how do we pick which specialty kits for which patient?
Right.
And so a lot of that comes, from a very intensive intake form. And, there's all kinds of different things that I look at in order to determine which systems of the body are likely the most important to focus on. So,
is there anything you want to add about labs?
I think we beat it up pretty good.
Well, listen, if you
there's a lot more to it, but
yeah.
But yeah, I think we did a pretty good job.
There's a whole ocean of information, but listen, if you want more, if you want to know more about your labs, if you want to know how to get labs started and get a detailed consultation with us, you can contact us at contact@worldviewwellness.com. You can also visit our website, worldviewwellness.com.
Or the phone number is 806-239-2559.
We can go really as deep as a client wants, or we can keep it light depending on what their needs are.
We can always play in the shallow end.
We certainly can. We certainly can, and we do. But listen, we test, assess, address, and never guess. And be good to yourself, because your health matters.
Absolutely.
We'll see you next time.